Hi, Peter.
Hey, Christine, how are you?
I'm good. How are you?
I'm good. I'm
How's your
it's going well. It's my birthday today, so I'm kind of celebrating a couple of things, but I've had some great conversations with some clients this morning, so it's been a good day.
Sounds good. Happy birthday. And I see that your kids made you breakfast this morning.
They did. That was an exciting surprise this morning.
That's so cool. Well, thank you for joining me today in this interview because I've had so many people reaching out to me about Medicare and what to expect, and they're lost. And I perfect because I know you, and I know that you'd be the perfect person to talk to. So I just want to thank you for joining me today.
Of course.
Let me share a little bit about Peter to the group. Peter is an Egyptian American and has been married for 17 years to his beautiful wife, Bonnie. She is a supervisory social worker for the state of California. They have two amazing kids, Noah Liam, age 5, and Julia Grace, age 10. He was in the nonprofit sector and a pastor for 22 years. He then transitioned into the insurance industry for 3 years. Peter's family was featured in a local magazine in February of 2020, Neighbors of West Chino Hills, for the business they work and the impact in their community. He was also featured on Biz TV Los Angeles for an interview about Medicare. He is also an ambassador for Chino Valley Chamber of Commerce since February of 2019 and a member of the BNI Chino Valley Strategic Alliance Group. Peter is looking out for the best interests of seniors. He has no bias toward any carriers. Peter works with all the top star rated plans. He's contracted with Scan, United Healthcare, Anthem, Humana, HealthNet, Blue Shield, Aetna, Silver Scripts, and Molina. Peter can help with Medicare, MediCal plans, Medicare supplement plans, Part D plans, as well as low income help for Part D. So I do have some questions for you, Peter.
Okay.
Let's jump right into it. Why did you decide to go into Medicare?
So for those who don't know me, I was in the nonprofit sector for about 22 years and just have a servant's heart. I love helping people out. And so I felt like after I left the nonprofit sector, I felt like this was a great place to go for my skill set in helping people kind of navigate the Medicare journey. And like I said, I love helping people. I'm all about educating and giving free consultations.
Awesome. Now, how old do I have to be to start thinking about Medicare and why?
Well, honestly, people say you should wait until you turn 65, but I do have some prospects that I work with who are 63. So I would say if you're turning 63, you need to start thinking about it because there's so much out there. There's so much terminology, and it gets kind of confusing. So it's important to start planning ahead. And so I can work with you. And then when we turn 65, we can get you on the right plan.
Good to know. Now, how does one enroll or start the process of Medicare?
So it's recommended that 90 days before you turn 65, if you're not collecting Social Security, that you contact Social Security office to start the enrollment process with Medicare Part B. You're automatically enrolled in Part A, but you do have to start the paperwork to get into Part B. So 90 days before your 65th birthday.
90 days. So this is very confusing. But what's the difference between Medicare, MediCal, Medicare supplement, and Medicare Part D?
So I will try to break this down as simplistic as possible. So Medicare is the federal government healthcare. That's what we pay our taxes into. If you're a W-2 employee, or even if you're self-employed, you're paying into both Social Security and Medicare. That's taken out of your paycheck. And so that is something that we all are entitled to when we turn 65. Medicaid is actually a state subsidized health program for those who qualify. It's usually for those who are low income. We're talking about for singles, $19,000. Married would be about $24,000 gross for the year. And then Medicare supplement are for those who travel a lot when they're retired. It's for those who want to see any doctor that they want and be 100% covered. And so I usually sell these kind of plans to folks who are traveling to other states, visiting family, and God forbid anything happens to them. If they have a supplement plan, they are 100% covered. And then Part D is your prescription plan. And that's something that you have to have if you don't have a Medicare Advantage. So let me break this down even into smaller bits. Medicare Advantage is called Part C. That encompasses A, B, and D. If you don't have Part C, then you have to get Part D. That's kind of just the way things are set up. So I hope that helps make a little bit of sense of all that terminology out there.
That definitely does. Next question is, what makes one insurance company better than another one?
So the federal government actually rates all our plans that are out there from 1 star, which is the worst, to 5 stars, which is the best. And so there are some plans that people are in that are even not rated at all, which means that's not a good thing. That means the federal government has passed on rating them because they're so bad. So ratings are based on both customer service and health care needs. And so I always try to get my clients on plans that are 4.5 stars or above.
Okay, got it. Now, can you help me if I'm on both Medicare and MediCal? And if so, how does that work?
Yes, people don't realize that there are plans out there with insurance companies. If you're on both on Medicare and MediCal, there are extra benefits out there at no extra charge that you can get on. And it's easy. It's an easy enrollment process. It takes about 5 minutes. And you get extra benefits like chiropractor, acupuncture, in-home support services, emergency response system. All those benefits are at your disposal. All you have to do is get with a trusted agent.
Got it. And you are a broker, so do you offer any help or any other products?
I do. I'm actually just contracted with Cover California. And the reason being is I do have some clients who have spouses that are under 65 and need to find some kind of healthcare need options to fill the gap until they turn 65. So I do offer health insurance. I also offer life insurance on the side, but 90% of my business is Medicare. And like I said earlier, I do offer also Medicare supplement plans.
Got it. Now, last question. What is annual enrollment period? And I keep getting inundated with mail every October about Medicare. Why is that?
Well, unfortunately, annual enrollment period is your opportunity to review your plan and switch plans. And so just like with an employer, every fall you get to change your health plan if needed. Same thing with Medicare. You're able to change your plan at any point in October through December 7th. And that's what's called the annual enrollment period.
Got it. Thank you so much, Peter. This helped me a lot, and I'm sure it's going to help all my contacts on my Facebook, WeChat, and Instagram. Thank you so much. When and if they want to get in contact with you, I would be giving your information to them. Is that okay?
Yes, please do. And it was a privilege and an honor to be interviewed by you, Christine.
Thank you, Peter.
All right. Bye.
Bye.